what is the story with Chestertown now, and how it is preparing for this crisis, either in the future or as we speak now?
Well, this has been just an incredibly unprecedented scenario. It's my first global pandemic. I'm assuming it's probably yours as well. Just the warp speed at which things have been coming at us has been really incredible. And I honestly, we're a little behind the eight ball, but we're starting to catch up. Just recently, I started joining a call every morning with the emergency operations system for the county, which links the health department, emergency services, the hospital, and we all basically, county representatives, town representatives, and we all basically get on the same call just to make sure we're all on the same page. So that's something I just literally got off a call with all the mayors up and down the whole Eastern Shore to talk about, brainstorm about different ways to communicate with our constituents, to run meetings virtually, which the town has never done before. So we're kind of making things up on the fly, to be honest, and it's been very, very challenging. But I just got off the phone with an official at the hospital. I'm contacting them a lot more than I normally would, just to talk to them about capacity and whatnot. So it's really just a matter of ramping up all these communications, both internally and externally, in a time where people, like you said, they want answers, and I can't necessarily provide them with answers, but at least I can tell them what we're doing right now.
I think we're all kind of waiting for word from Washington College about the fate of one of their students who apparently had tested positive for the virus. Do you know anything, any updates on that?
I really don't, other than what I see on their webpage. Apparently, they sent the test off to an independent lab, and there's such a huge backlog for analyzing these types of tests right now that it's just taking forever. But it doesn't really even matter. I mean, right now, technically, we don't have any confirmed cases in the county, but I think that's a false assumption because there's been almost no testing done because there's no test kits. And this isn't just a problem here in Kent County. It's a problem, as we all know, on a national level. And that's one of the things we talked about on the call this morning with the EOS is, they're requesting tests and they're just not a lot to go around. So that is why the social distancing measures are so critical, is because, as I'm sure you've heard, you can be asymptomatic with this disease but still be infected. And that's when the virus has the advantage, when you don't know that it's out there and people are interacting with one another and unknowingly transmitting it. And even though the people that are getting it might not have massive complications, they end up interacting with seniors and people with underlying health conditions unknowingly. And that's what's so scary about this issue. That's what's so concerning. And that's why Governor Hogan has taken such aggressive actions to stop the spread.
Do you have any knowledge of whether or not either Chestertown or Kent County's first responders have been tested?
I do not have any knowledge to that, no. I assume they probably haven't, because what we've been told by the Kent County Health Department is, these tests are so hard to come by that unless you're presenting pretty serious symptoms, you're probably not going to be prioritized to receive a test.
And as you look at the town's role in something like this, what are you thinking is on the first of your list as you talk to your peers on that conference call? What are people most focused on?
Well, I think on a town level, the number one thing that the council has discussed is the capacity at the hospital vis-a-vis the nature of our population here in the town and the county, and that we have a lot of older residents, that are potentially the most vulnerable. And so just how critical it is for us as a town, on the town level, to control the activities, the properties that we own, to control and limit access on buildings that we own, like town hall. And it's tough. It's tough also communicating about like town events that we know always draw crowds with the weather cooperates. So I think on one level, it's just doing what we know we can do right away to limit crowding and keep people spaced out. And then now I think now that we've done that initial work, it's more a matter of, okay, how do we effectively continue communicating with our constituents in a time when you can't sit in the same room together? That's something that we've really never had to do. We've done it. We've taped our meetings and put them on tape delay. But I think right now people just want to be talked to. They want to hear what's going on. And it's really frustrating because the normal methods that I would use are not allowed, which would be I would call a town meeting and have everyone come talk to me at town hall.
Yeah.
So it's really uncharted territory, I think, for all of us, but especially in a small town like this with limited resources, it's going to be a challenge. It's going to be a big challenge. And of course, I'm also, in theory, I'm a part-time mayor. So I have a job that's directly impacted by school closures. What do you think that looks like right now for me on a personal level? I have 2 kids at home because school's out. I have a senior in high school who's, missing his whole lacrosse season, and I'm dealing with all this all simultaneously. So it's a handful. It's a real handful, but I'm going to do my best to keep communicating to the best of my abilities. The good news is we have a great council right now. All 5 of us, I think, are very active, engaged, in what our responsibilities are. And, it's taken us a little while to get coordinated, but I think you're going to see moving forward that, we're going to be as communicative as we can possibly be with this, because it's very important, obviously.
Have you been in touch with Shore Health and what the Chestertown Hospital facility could be used for?
I just got off the phone about 5 minutes ago with Trina Williamson, who is their public relations officer, and she has great information. Also, there's a representative every morning on this call, the emergency system, and apparently Ken Kazell is going to be on the same call on Wednesday morning. So yes, I have been in touch with them, and Trina, she couldn't really get into specific details, but suffice it to say, and I know you had an interview with one of their physicians or administrators, they're looking at what to do to increase capacity in the event of a surge. And that's all I really could ask for from her is they're looking at every room in their existing building, not just in Chestertown, but up and down their system. And even beyond that, if every building were to be full, I think they're open to looking even elsewhere in the community if they had to.
I just wondered if there was anything else you wanted to say to the community since we have this time together.
I would just say, keep your head up. We're all going to get through this. There's definitely going to be some tough times ahead, but we're going to come out on the other side. Just know that your elected officials are all pulling for you. We'll work as hard as we can to communicate everything that we know as when we know it. And just hang in there. It's unprecedented times and we're all struggling through it together. But the greatest thing about Chestertown is the residents of Chestertown. And I'm sure we'll come together and, put our brave face on and make this work.
Thank you, Mr. Mayor.
Thank you.
Indeed.